Morning, everyone, and thank you for joining us for this webinar on the Healthy Steps program. My name is Diane Delano, and I am Policy Analyst at Advocates for Children of New Jersey, focusing on infant and toddler issues. We are very excited to have with us today Pamela Tu from 0 to 3, as well as Christina Ruopozo, a Healthy Steps Specialist currently practicing in New Jersey, who will share with us information on the Healthy Steps program model and how it is a vital resource for families with babies and toddlers in New Jersey. Now more than ever, parents are in need of easily accessible supports to promote the health and well-being of their children. The pandemic has greatly increased the level of stress and anxiety that naturally accompanies parenthood and has created additional barriers and challenges for families in accessing services that can have a negative impact on a child's healthy development. What we love about this model in particular is that it is based in the family's pediatric practice, where parents visit regularly, they have a trusting relationship with the practitioner, and are very familiar with the staff. So this makes it a highly effective way to improve maternal and infant health during the critical postnatal period. I don't want to say anything more because I know Pam and Christina have a really excellent presentation for you today that is going to explain more about the model and how it's been helping families here in New Jersey. What we need to do is make sure that if you have questions during the presentation, that we need you to put them in the Q&A box, and then we will have a period of time at the end to answer all of your questions. So before I say anything more, I'm going to turn it over to Pam, and thank you again for joining us today. Pam?
Thank you so much, Diane. And of course, thank you to ACNJ for hosting this webinar and highlighting the new Healthy Steps Initiative in New Jersey. Again, my name is Pamela Winkler Tu. I'm with the Healthy Steps National Office. Healthy Steps is a program of 0 to 3. And I work with the Healthy Steps National Office on the policy and finance team, and I'm solely focused on the sustainability and scale of Healthy Steps in New Jersey. I'm going to tell you a little bit more about that in a few minutes. Catherine, if you could go to the next slide, or start the slides, I should say. And you can go to the next slide. So just a little bit about what we're going to be talking about today. I'm excited to be here with one of the first Healthy Steps Specialists, I should say the first Healthy Steps Specialist in New Jersey, to introduce the Healthy Steps model to you, tell you a little bit more about the ongoing broader Healthy Steps initiative in the state, and then make connections with you all in the hopes to have future partnership opportunities, both at the practice level, connecting with our existing Healthy Steps sites, and then partnering possibly around our advocacy efforts to identify a sustainable financing model here in New Jersey for the program. Before I dive into the model's core components, we're going to share a brief video. Catherine, if you could go to the next slide and start that. It's a nice illustration and overview of what you're about to hear more about.
The family life that I grew up in was pretty rough. There was a lot of abuse. I would never want that for another person, for another child. 2 months before our wedding was set, I found out I was pregnant. I was told that it would be a good idea for me to abort him because carrying him could be detrimental to my health and his. I looked at the doctor and I said, I'm having this baby.
Motherhood didn't come as naturally as I kind of thought it would. When she came, we did not feel totally prepared, and her birth was rather sudden and tumultuous.
Now I was scared. Every time I had a contraction, I was afraid that I was going to rupture. I made it to the day they scheduled my C-section, and my uterus gave out on the operating table. Being able to take him home, I was so happy. All I kept saying to him was, we made it.
Even after we came home, it was kind of rough. I felt horribly guilty for what Caroline had gone through, that I hadn't been able to, take care of her, that she'd been alone in the NICU for a while. Family wasn't really available to help or willing. I went through a lot of depression at that point.
With Flake, I was so scared. I thought every negative thought, we're not supposed to be here. We beat these odds, so something's gonna go wrong. And then a knock at the door came when I took him to his first appointment, and it was Janelle from the Healthy Steps program, and she said, "Hey, do you have a moment?" And I was like, "I don't know who you are, but you look like an angel."
Healthy Steps is the integration of health and parental support right here in pediatrics, starting from that very first newborn visit. It's stressful to be a parent, and it's isolating to be a parent, especially for people who have a history of trauma.
That was scary. Here I'm pregnant, and I'm thinking, yeah, I would like to just go to sleep and not wake up again. And that's when I was like, I should just not be alone right now, because I don't even want those thoughts.
When we talk about perinatal mood and anxiety disorders, postpartum depression, not a lot of people are asking about that in pediatrics. Healthy Steps asks those hard questions.
I think when you show genuine interest in a parent's well-being, they start to build trust. And through that trust, we can really work together to talk about the baby.
Okay, this way, buddy, this way. As soon as the nurse puts you in the waiting room for the doctor, the Healthy Steps Specialist will come in, and she'll usually have a questionnaire for whatever kids at the visit. When you finish that, she'll go over it with you. And they ask you if you have any concerns or issues.
For a while, we were just watching his milestones, and because he was premature, we were just constantly worried about that. And she held our hands every step of the way. I was in a very unhealthy place, worrying every single day that something was gonna happen to Lake, instead of allowing him just to be 1.5 years old.
Raising a child is hard, and it's uncertain, and it's unpredictable, and you're vulnerable when that happens.
When I'm just by myself and it's all in my mind, you feel like there's something wrong with me, that I'm broken, that I'm not handling this stuff. And she was like, "You're doing great for the circumstances you had."
We work together to kind of reassure the parent and ask them about those instincts that they're feeling and give them the reassurance that it's okay. They can really trust themselves and what they think is best for their baby.
They feel so good about themselves after our visit that they want to come back.
Healthy Steps, this is Janelle. The best part of my job is knowing that someone who came to the doctor for their flu shot or for a well-child visit also got an opportunity to talk about the other things that are hard for them. Whether I'm directing people towards resources in the community, or whether I'm having a session with a parent where they got to relieve a little bit of their stress or take a little bit off of their plate. It's that they came here for their kid, but the family was served.
I think the most beneficial aspect that Healthy Steps has added to my life is to just provide reassurance and really help find in me the answers that I'm kind of seeking for them, and to have the confidence that I can do this. I am, this child's parent, and I have everything I need to be this child's parent, to do a good job at it.
It has allowed me to be the type of mom that I wanted to be. It has allowed me understanding and peace of mind to raise Lake to be his natural, normal kitty self. I'm not afraid anymore like when he was first born. I look at his birth story now as, yeah, I went through that, but in the process I got to meet Janelle, and I got to have someone that I consider a partner in my parenting process. I feel stronger as a parent with Healthy Steps.
Thank you, Catherine. You can go to the next slide. So I'm going to try to be brief here. My goal is to share some of the more academic components of what Healthy Steps is and does with you, and then I'm going to turn it over to Christina to talk about some early successes that she's had working with families as part of Healthy Steps in New Jersey since the inception of the program here in January 2021. So Healthy Steps is an evidence-based program that resides within the primary care setting, and it really can exist anywhere that well-child visits take place. So both in a traditional pediatric practice or an FQHC or family health center. The model's main focus is on children age 0 through 3, as we said, and their caregivers. So we really think about the parent-child dyad as the patient within the HealthySteps program. The model focuses on promoting positive parenting, healthy development for babies and toddlers, and relies on an interdisciplinary team member that we call the HealthySteps Specialist. The specialist is a child development specialist, often a licensed clinical social worker or child psychologist who is integrated into the pediatric primary care team. That person, along with other practice team members, really ensures the implementation of universal screenings for all families, and they do a lot of work around referrals for both the child and the caregiver, and provides more intensive services to families who may need a bit more attention. Next slide. So part of the power of the model is that it exists in a universally accessed and trusted setting, the pediatric medical home. We know that parents almost always take their children to their well-child visits, even when they aren't necessarily seeking care for themselves. We also know that caregivers continually rank their pediatricians as highly trusted year after year. Pediatrics is a place where families and caregivers can find out what it takes to be the best parent they can be. The HealthySteps Specialist establishes a trusted relationship from birth with families and can raise and discuss sensitive subjects in a safe and positively stigmatized setting. This promotes early identification of risk factors and mitigates potential negative social emotional development or medical impacts for children. Next slide. So there are 8 core components to the HealthySteps model. The first 2 are around screening, both child development, social emotional screening for children, and also screening for family needs, which includes postpartum depression screening, looking for risk and protective factors like intimate partner violence or substance use disorder. And we do a lot of work around identifying social needs related to social determinants of health, because we know whatever is going on with their caregiver is also going on with the child. We require that our sites provide a child development support line. This can come in a variety of forms, but it's really whatever is best for the practice, a way for all families to have access to the HealthySteps Specialist and ask questions that come up throughout that first 3 years of life. We also know that some families may require short-term supports. Those are what we call child development and behavior consults. So for issues like sleep training, toilet training, maybe biting, issues that you may want to talk to your pediatrician about, but don't necessarily have time. This may be 1 to 3 visits with the specialist, get you over that hump, help address the issues, and then hopefully those issues can be resolved. If not, of course, the specialist can continue to work with the family longer term or provide appropriate referrals to services outside of the pediatric practice. Then we have the core component around care coordination and systems navigation. So specialists spend a lot of time linking families to services, making that warm handoff, and more importantly, following up to make sure services are being received. Everything from early intervention to housing, food insecurity referrals, and Christina's going to talk more about what that has looked like at her practice. HealthySteps Specialists also support families through the delivery of positive parenting guidance and anticipatory guidance. That's a key part of HealthySteps. Our national office provides sites with a host of resources to inform the discussion specialists are having with families. Also, early learning resources, because as you likely know, what happens in that first year of life really is a predictor of future school success. And then finally, for families that are in need of more intensive supports, the HealthySteps Specialist attends every single well-child visit through that first 3 years of life, and they jointly manage the visit alongside the pediatrician or clinician. The specialist can serve as another contact for the family and often serves as an advocate for the family within that visit and for other resources that may be needed. Next slide. So briefly, this is how we think of the tiers of service. So HealthySteps is a risk stratified model. This ensures that the more intensive services are really going to the families with the most need. So child development screenings for family needs, and the child development support line must be provided to all children 0 through 3 and their families in a practice. If you're going to do HealthySteps, you have to agree within a 3-year time frame to provide all of these services in Tier 1. And our national office monitors fidelity on all these core components. From there, obviously, in the screenings and clinical observations and working with families, you can determine who needs a little more support. And practices have some flexibility around how they make decisions in terms of where families receive services, maybe moving them into tiers 2 and 3, and there's flexibility in the criteria for that, and also for families to move within the tiers during that time frame. So for families where we're seeing the lightest of pink flags, that's when we get into tier 2. Those are, again, families who need some short-term help from the HealthySteps specialist, maybe 1 to 3 visits, maybe a couple of referrals, and then they would bump back down to tier 1. We know that for some of our families, they need a lot more support, and so those are the tier 3 families. They get all of the services in tiers 1 and 2, and they also get the HealthySteps specialist attending every single well child visit. The tiers are really a way to figure out who in a practice benefits more from more intensive services from the specialist than other families. We don't have a lot of families moving out of tier 3, so once a family is identified as needing that additional support, they generally stay there. And we typically say that one HealthySteps specialist can serve up to 2,000 children age 0 to 3 in a practice, and about 15% of those families will end up in tier 2 and about another 15% in tier 3. Next slide. So briefly, want to tell you a little bit about our national network. So HealthySteps came to 0 to 3 in 2015 and is in a period of growth. So we see an average of 23% of growth year over year. Currently, we have 197 sites across 24 states, DC and Puerto Rico. Next slide. So now I'm going to tell you, and you could go on to the next one. I'm going to tell you a little bit more about what's happening with HealthySteps in New Jersey. So prior to 2021, there was no HealthySteps in the state. But these 3 foundations, the Burke Foundation, the Turrell Fund, and the Nicholson Foundation, seeded money alongside Hackensack Meridian Health to bring the model to New Jersey and to have a real intentional focus on sustainability of the model and scaling the model across the state. Next slide. A little bit about the 3 initial practices within the HMH network. So Christina is the specialist at the pediatric academic practice in Bergen County. It's a fairly new practice with a growing patient population. Then we have 2 practices in Monmouth County, the J&H Booker Family Health Center, and then Neptune and Asbury Park Pediatrics. And Adiza and Tierney are specialists there at those practices, and their contact information is at the end, and the slides will be available. If you are providing services in those areas and want to connect, feel free to reach out. Next slide. So the HealthySteps model addresses both child and family needs and aligns well with other statewide health and well-being priorities. Sometimes I like to describe HealthySteps as a hub and spoke model. New Jersey is very rich in resources, and the HealthySteps specialist can be key in connecting families to the robust service continuums that exist throughout the state. Putting HealthySteps in more primary care practices and health centers across the state would fill a gap that currently exists in the early childhood and maternal and infant health service continuums and ensure families are connected to services that can help build resilience. Next slide. In a moment, I'm going to turn it over to Christina, one of our fantastic HealthySteps specialists here in New Jersey. She's going to share stories of early successes implementing HealthySteps at the pilot sites, while also touching on some of our key outcomes and HealthySteps aims to impact. HealthySteps went through a randomized control trial in the mid-2000s, and that evaluation, along with subsequent site-level research, show that HealthySteps increases connections to resources, increases breastfeeding rates, and improves early nutrition, improves child's health and development, improves parenting knowledge and practices, increases parent and physician satisfaction, reduces maternal depression, improves early literacy and school readiness, and increases child safety. All right, so now I'm going to turn it over to Christina, who will go more in depth into what this really looks like in the context of the pediatric practice she works with in Bergen County. Christina?
Good morning. I'm excited to be presenting to you all today about Healthy Steps. Can we have the next slide, please? As mentioned, I'm a clinical social worker and I've been practicing as a Healthy Steps Specialist for the last year at the pediatric academic practice with Hackensack Meridian, Hackensack in the Bergen County location. So I wanted to touch on a little bit of evidence and then share a case example. So evidence shows that children who participate in Healthy Steps have timely and complete well-child visits, timely and up-to-date vaccinations, and better continuity of care. So as mentioned, at each well-child visit, we screen for developmental milestones and behavioral and emotional functioning, including family needs. So that would, we're asking questions around food insecurity, marital partner relationship issues, and maternal caregiver emotional changes. So what the evidence shows is that early identification of child and family needs and improved connection to services. So children involved in a Healthy Steps program were 8 times more likely to receive a developmental assessment and had significantly higher rates of developmental referrals. Healthy Step practices with a dedicated family service coordinator quadrupled its early intervention successful referral rates. I'd have to say on average, I'm making at least 1 to 2 weekly referrals to early intervention. Families also significantly have higher rates of non-medical referrals, including referrals for child abuse or neglect, marital family issues, and other social or environmental issues. Just to add to that, I would say I'd make at least 1 to 2 food insecurity referrals per week. This time last year, when I started in September, when I think families were really dealing with the financial hardship related to COVID, those referrals were doubled. And I was making referrals for food insecurity as well as other financial hardship, referrals for rental assistance as well. Next slide. Okay, so families involved with Healthy Steps showed improved maternal depression screening. Mothers are more likely to share symptoms. Providers are more likely to discuss postpartum depression and fewer reported symptoms. What I like to do at the newborn visit is I always try to make a point to introduce myself and the Healthy Steps program. I like to let families know that I'm here. I like to assess family support systems, any needs or concerns. I spend some time normalizing the emotional ups and downs of caring for an infant. I also like to provide education on perinatal mood and anxiety disorder signs and symptoms, and destigmatizing the need for support and mental health services. So I just like to kind of set up my introduction in that way during the newborn visit. All right, so this slide is about social and emotional development. What the evidence shows is that children at risk of social emotional challenges had higher rates of referrals, and these are children involved in the Healthy Steps program. At our site, physicians have reported how helpful it is to have a Healthy Steps specialist to refer for follow-up with families. We get a lot of referrals around separation anxiety, managing tantrums. I think biting had been mentioned before. And some of these families benefit from a couple consults over the course of a couple of visits. And some families we continue to follow. Families involved with Healthy Steps received more anticipatory guidance on child development topics, including temperament and social skills. And parents were more likely to notice behavioral cues and provide age-appropriate nurturing.
Thank you so much, Christina. I'm going to take it back over here and just talk very briefly about kind of the broader HealthySteps initiative in New Jersey and what we're hoping to do. And when I say we, it's really a group effort. So we have the three great funders that I talked about who are local, relatively local to New Jersey: the Burke Foundation, the Turrell Fund, and the Nicholson Foundation, who have been fantastic partners in this effort. And not only are they helping to fund the initial 3 pilot sites, they're investing in a robust effort to identify sustainable financing for HealthySteps in New Jersey. At the HealthySteps National Office, we know it's critical to work with payers, so insurance companies, the state Medicaid agency, to identify sustainable funding streams in order to be able to scale the model throughout a state. To be perfectly clear about it, what we're trying to do is figure out ways to get the pediatric practice or the providers, including the specialists, reimbursed for the services the specialist is providing. So we know a lot of practices operate through fee-for-service reimbursement. And the work that Christina and the other specialists are doing is really preventive in nature, and that's really difficult to get reimbursed. That's the most basic, at the most basic level, that's what we're working to change. Really figuring out and helping payers figure out, because it is complicated, how they can fund this kind of integrated care in the primary care setting. So we have additional partners. As I said, it's a group effort. Seton Hall Center for Health and Pharmaceutical Law and Policy. Manat Health has partnered with us, along with ECNJ, and we've had a lot of support and partnership with the Integrated Care for Kids Initiative and the New Jersey Healthcare Quality Institute. And this is really the road we're on. So we, as I said, we got this philanthropic support to start up, and we're in this period of identifying sustainable funding. But the goal is, once those sustainability options are there for practices, that we can look to scale the model. And the real cost of the model is the HealthySteps Specialist salary and benefits, and the training and onboarding costs to become a HealthySteps site. But it's the practice that is HealthySteps, right? So we hold the model here at 0 to 3, but the practice becomes a HealthySteps practice, and that's just the way that families experience their pediatric provider. Next slide. I don't know how many of you are interested in these billing pathways that we're advocating for, but if you are, please reach out. This is where we're partnering a lot with ACNJ and our other sustainability partners to think through the best way to do this. We've seen some really exciting developments in a few states recently where they are opening up these billing pathways. So in California, recently they did 2 things. One, they allow their family therapy benefit to be billed, providers to bill that benefit, even when a formal behavioral health diagnosis is not present. So there's ways to identify what risk factors a family might have and provide the services and receive reimbursement. They also just passed a new dyadic behavioral health benefit that isn't fully developed yet, so we don't know exactly what it's going to look like. But it really is modeled on HealthySteps in the legislation that was passed, and is a way to reimburse for these dyadic visits. And then in Massachusetts, they recently did something very similar where they're allowing for therapy, psychotherapy services, including family therapy, to be billed without a formal behavioral health diagnosis, as long as there's a positive behavioral health screen. And then we talk a lot about alternative payment models in the Medicaid world, and it's something that we have our eye on as more and more Medicaid agencies and Medicaid managed care organizations move toward paying for services differently, right? Not for volume, but for quality. And so we have an alternative payment model framework that we've developed at the national office to help inform conversations about a pediatric focused alternative payment model that really encourages providers to invest in these kinds of services. Next slide. So that's the end of our formal presentation. We want to answer some questions. I know a lot have been coming in, so I think, Hannah, you're going to facilitate that, right? And as you can see here, our contact information, both for Christina and I, but also for the other two specialists. So Adiza is the specialist at the Jane H. Booker Family Health Center, and Tierney is the specialist at Neptune and Asbury Park Pediatrics.
Okay, so, hey, I don't know. Oh, there's my camera. Okay. I just want to first, before we get into the questions and answers, just thank both of you for this great presentation. And Christina, the work that you're doing with these families is just really unbelievable and exciting. So we have a number of questions that I wanted that, and if anybody still has some questions, please just put them in the chat box. And we'll respond. So the first question is, who can become a HealthySteps specialist, and is there a training that they need to go through?
So the training is inclusive. It's an onboarding process that includes training. So there's a few different steps to it, but really, and I think this gets to a few of the questions. The pediatric practice is who becomes a HealthySteps site, right? So it's not just a HealthySteps specialist, and that practice hires the specialist or can repurpose. Maybe they already have a social worker on staff, and that person serves as the HealthySteps specialist. So not only does the specialist, once hired, get trained, the entire practice gets trained. So everyone from the front desk staff to there's always a physician champion in every HealthySteps site, and we talk about it as real practice transformation. I think another angle to that question, which might be what you were asking, like what's the qualifications to be a specialist? So we have baseline fidelity requirements, so training and education. But then the site can decide if there's other criteria. So in New Jersey, all of our specialists are licensed social workers or licensed clinical social workers. About a third of our network are licensed child psychologists. We really often encourage practices to hire licensed behavioral health clinicians. It helps with sustainability, but also providing that integrated behavioral health component of the model.
Great, thank you. Okay, and then the next question is, would you say that HealthySteps assimilates a federally qualified health center with a focus in pediatrics standing in place as the medical home, but also provides social early childhood services to both the child and the family?
Yeah, I think so. I just want to sort of like push this idea, because some of these questions are getting to, it's hard to really like understand how it works, but this is the families, every family with a child age 0 to 3 in a practice, this is how they experience their pediatric practice. So whether they're going to an FQHC that is a HealthySteps site or a more traditional pediatric practice that has a specialist, this is pediatrics as they know it, right? It's this interdisciplinary team approach to delivering well child care, and it's different. And I think I'll just answer the income limitations or requirements for eligibility. We require that every family with a child age 0 to 3 in a practice receives HealthySteps regardless of income status. So the financing of it is where we think about maybe what kind of insurance a child has, but regardless of what insurance or income status a family has, they receive HealthySteps if they have a child age 0 to 3 and they go to that pediatric practice.
Okay, great. And then the next question is, I'd like to know about some lessons learned from unsuccessful family interactions, if any. So maybe Christina, you can respond to that.
Sure. The only that come to mind are the families whose children I've met who are older than 15 months, who haven't started with our practice with HealthySteps integrated. So introducing myself and the model, some of those families have not been interested in the program or meeting with me. And so that's okay. I just let them know that I'm here and let them know about this new initiative and that it's available. But I certainly don't, families can opt out. But for the families who've started from the newborn visit, and as I mentioned, I try to meet with families during the newborn visit and again at the 2-week and the 1 month and the 2 months. That's the model that they're used to. So they don't necessarily see me as separate. I'm embedded into the service. After the provider comes out of the room, I'm jumping in, I'm introducing myself. If it's a family that I continue to follow very closely, I'm joining in, during the well child visit when the provider's in the room. But I have had some experiences with families who are not comfortable. And I think that has a lot to do with the fact that they didn't start here with that model.
Thank you, Christina. And then the next question is around the cost of the model, Pam. So what is the general cost to cover a HealthySteps specialist, inclusive of onboarding, et cetera? Is there like a salary range?
Yeah, so there's a lot that goes into that, including the number of children aged 0 to 3 served in a practice, because we do have smaller sites, especially in rural areas, where they're not seeing a high volume of children aged 0 to 3. So their specialists may be seeing older kids as well. And that's part of how they sustain the model. Maybe they're doing, you have a teenager with suicidal ideation, and the social worker who's serving as the HealthySteps specialist may also be seeing that child. So that has a lot to do with sort of the quote unquote cost, right? Because as we said, the main cost of the model is the salary and benefits. And the site determines what that is, and it's appropriate to the geographic area they live in and the licensure of that person. We do have sites that have community health workers who serve as the HealthySteps specialists, and we can provide waivers if necessary, if it doesn't meet our fidelity requirements, if that's really what a community can provide, right? We don't want a licensed behavioral health professional stature to prevent a site from really focusing on child development in young children and positive parenting, right? So there's more professionals who can do that. The training and onboarding costs. So currently it's shifted in the COVID era. Here we're doing all of our trainings virtually, and we're continuing to adjust the structure. Right now it's $20,000 training and onboarding costs for a site to become a HealthySteps site. And once you're a site, you're in our network. So that is a nice piece of it, and you really get access to all the resources and there's a year's worth of technical assistance provided with that, and ongoing support around sustainability from our policy and finance team. So we really do support sites around professional development and lots more.
So Pam, is that $20,000 a one-time fee, or is it each year? So it's the first
time.
year you would pay that, and then you would get ongoing support even if in year 2, 3 and beyond. Yeah.
And on the costs, that person can feel free to reach out to me, because we can provide more specifics if we, in different scenarios on how you can sort of cost model what it would take to support the program.
Great. So the next question is, what went into your decision to select Bergen and Ocean County over Atlantic and Newark or Essex County, which have the highest Black maternal and infant mortality rates in proportion to the population in New Jersey?
That's a really interesting question. And I think it speaks to kind of how HealthySteps comes to be, really, which is fairly organic. Most of the time sites come to us and say they want to be a HealthySteps site, right? And in the case of this initial pilot, it wasn't that the state, put out an RFP and then it selected practices from particular areas. It was that, Hackensack Meridian Health had a champion who knew about HealthySteps from their work in New York, where one of our flagship health systems is, and came together with the philanthropic partners to do HealthySteps within their health system. And these were the practices that both had a physician champion who was ready to take it on, right? Because there's a readiness component to this. And also, that's where they had pediatric practices. So it is the goal to spread HealthySteps to more counties, especially counties that have high rates of disparities in terms of health outcomes and access to health services. But we are ready and willing to partner and have this with practices that are interested in those counties, and knowing that, we're working on the sustainability piece of it. And we want partnership in that, and having more sites is having more partners.
Right. And this is where everyone's advocacy comes in, that if you're in an area where you think would truly benefit, which is the entire state actually, but in those that have higher concentrations of maternal and infant mortality, this is your opportunity to speak up and talk to people about how they can work to bring this model to additional pediatric practices within those communities. So the second part to this question was, given that the New Jersey Department of Health has ongoing efforts to address the disproportionality of Black maternal and infant deaths, will your work help inform the work of the state, especially now that the New Jersey Department of Health is working on their Maternal Child Health Services block grant application?
I think the short answer is we hope so. So there is, the funders are also supporting, and Hackensack supporting, a robust evaluation of the impact of the model at these 3 pilot sites. And we are trying to get this information out to anyone and everyone, including DOH. So we're really trying to partner with state agencies who are interested in these kinds of services, not only looking at Medicaid as the payer, although that makes a lot of sense for a lot of reasons, but we know that the Department of Children and Families and the Department of Health, the Department of Education, all are connected to the kind of work we do by sort of topic area, right? And the outcomes that we aim to impact, they care about those. So we want to inform broader statewide initiatives and also be part of that service continuum. We know we don't operate in a vacuum, right? And we say we kind of stay in our lane in pediatrics, but we want to be good partners, and we want to make sure that HealthySteps is enhancing the great work already being done and connected and can be valuable to broader efforts like the block grant application. So we're always happy to hop on a call or be part of, a committee to inform that kind of work.
Right. And I do want to point out that HealthySteps model is aligned with the Nurture New Jersey plan as well. So it's another opportunity to help move this work forward. I know we're a little. Oh,
sorry. I just wanted to also mention the statewide ACEs Adverse Childhood Experiences initiative. That's also part of the new Office of Resilience. We're connected with them as well.
Great. I know we're running short on time. We have a couple of more questions, so if people could stay on for a few minutes so we can just get through the questions. This one is the model being currently implemented in Union or Hudson counties, or are there any plans at this point?
Not right now. We're just in Monmouth and Bergen County.
I just want to add to that, at our Bergen County location, we actually do service a lot of Hudson County families. I just want to add that.
So the families are tied to the pediatric practice as opposed to the actual community in which they're
Yes, and I think that might touch on another question. So the families who are served by HealthySteps are bringing their children, are receiving pediatric care at our practice. So we unfortunately cannot service other families who are not coming to our practice for their child's pediatric care.
The next question has to do with whether or not the program is voluntary, or can it be mandated through DCPMP or drug court? So if you could respond to that.
Sure, I can answer that one, Pam. It is voluntary. I'm not clear about it being mandated by DCPMP. That hasn't come up at all, but it is a voluntary program. But again, for the families that have started with us from their newborn visit, they've just become used to me, being part of the care team. But at any time, if a family, didn't didn't need my services or wasn't comfortable meeting with me, I don't continue, to be part of those visits, but they know that I'm here if something was to come up and they needed some additional support.
And can anyone refer somebody to the HealthySteps Specialist, or it is tied to the pediatric practice, so it would come from the pediatrician, correct?
So anyone within our practice, so yes, so the referrals come from our MDs, our residents, our medical staff, nurses, even the front desk staff. Sometimes if there's something they observe in the waiting room and they have some concerns, they may, say, hey, Christina, I observed this. Can this just be a family you can check in with? I also, we get a lot of referrals from our pediatric ER. So I'm in, communication with the residents there or the social workers involved in the ped social work team at Hackensack.
Thank you. And another question has to do with other states and how other states are sustaining the HealthySteps model. Are there any examples, Pamela, you could provide?
Definitely. So we do this kind of sustainability work that I'm doing here in New Jersey and other states. So in Colorado, it is funded through a state budget line item that practices can draw from. Then I mentioned briefly and have more information on this if anyone's interested in digging in. Recently in California and Massachusetts, we've seen reimbursement for preventive behavioral health services. So a lot of what the specialists do, if they're licensed behavioral health clinicians, would qualify as that prevention-oriented behavioral health work. And so those kinds of reimbursement opportunities really open up reimbursement billing pathways, which is what people like Christina and practices like the academic practice would leverage to support her salary, right? So we see in Massachusetts, they allow Z codes for social determinants of health as the primary diagnosis to bill family therapy. And in California, they use a different Z code to create the same billing pathway. And some of it's limited to the number of visits, others are unlimited. States kind of do it a little bit differently, but we have some great examples. And then we're really pushing states to think about parity, right? So we have a physical health preventive well-child visit schedule. And, it would be amazing to see that on the behavioral health side too. And those kinds of broader initiatives around better integrating care across the lifespan, right? Not just for children aged 0 to 3. HealthySteps sites can leverage to sustain the implementation of the program and their focus on young children.
And this is exactly what we're trying to work on at ACNJ in partnership with 0 to 3, is to really try to figure out what other states are doing to see what might be appropriate here in New Jersey, and to really try to figure out a way to bring this program to more practices. And again, this is where your advocacy comes in. Anyone who's interested in working with us and in spreading the word about the model and in helping us figure out ways to make it a sustainable program in New Jersey, please make sure you reach out to us. Please sign up for our ACNJ emails and alerts. You could do that by our website, acnj.org. And we have a few more questions, so I'm going to try to get through some of them. But if you had questions and haven't been answered today, again, please feel free to reach out to us. You will get a copy of this recording and the PowerPoint following this presentation. And I do want to say I'm just so excited that there's so many questions and so much interest in this model, because we really do feel like it is something that should be in every single pediatric practice. It's such a fabulous service. I mean, I remember when I was a young mom going into the pediatrician, and you feel sometimes kind of rushed, and to be able to then be able to talk to somebody and get connected with services following your time with the pediatrician is just, I think every parent should have that kind of service in their practice. Okay, the next question is there any way that a family can be referred without a pediatrician, or can pediatric ER refer? I only ask because many families I assist have very limited access to a primary care physician.
So at my site, and I believe the other two sites, they would just need to receive their pediatric care here. So some things come up, and I can only speak to my particular site. If it's an issue with the family is underinsured or not insured, our site does accept charity care, so I'm able to link the family to our financial office and support them in that process of applying for charity care, as well as connecting them with NJ Family Care and completing a Medicaid application. We would just need to, in terms of what HMO they select, we want to make sure they select the HMO that we participate with, and we do accept most private insurances. But with regards to referrals, I mean, a parent, they can refer themselves. They would just need, their child would need to receive the pediatric care here.
So it is tied to the practice, and they have to be right. But that's not to say that if the practice is accepting new families and the ER or other persons learn about this, they could recommend to that family that they, switch to that pediatric practice.
Correct.
Okay. So it's important for places like the centralized intake hubs to be familiar with which pediatricians are providing this kind of services. So that's good information to have out there in the community so they know what practices might be a good fit for families.
And I have to say, I'm surprised. We also, our site is located in Hackensack in Bergen County, but we have families that travel from Hudson, a few from Essex, Passaic County. So, the families make it work. I think, they feel comfortable with the physician. They feel supported here. So they make it work. They travel. So I think that speaks to itself.
Certainly, it is something that families search out when they're looking for a pediatrician, like what kinds of services are also, available through the practice, and how well they are in assisting new families with young babies. Certain practices, might do better at that. So having something like this, is certainly a selling point for pediatricians. Can trained pediatric nurses do this? The practice can be reimbursed. Insurance will pay for nurse services.
So our fidelity requirements require a bachelor's level person with child development experience. So it has more to do with their experience and background as being an appropriate fit. And we have sample job descriptions. So I believe that a nurse could fill that role, but they would be operating as the specialist, right? And not as the nurse.
And what is the duration of the program in New Jersey? How are families referred, or how do you connect with families?
So the program is through age 3. So before the 4th birthday, families essentially graduate from the program. And I think we've answered the referrals question. Really, it's really that they're receiving their well child care there. They're receiving HealthySteps if they have a child age 0 to 3. That's the most basic piece. So even Christina says, like, right, a child's referred from their pediatrician. She's right there. She's in the hallway. Right. So she's part of the care team. It's not a formal program where there's some eligibility criteria, right? And there's a requirement. It's does the family need some additional support that the pediatrician or provider can't give? That's what she's there for.
Okay, great. And are you reaching out to New Jersey clinics and pediatricians to inform them of the model, to assess interest?
The short answer is not yet. We really are in this, we have this intense focus on sustainability right now. if there's funding to support new sites, we're more than happy to get them trained and onboarded, right? If a practice feels like they are able to support a specialist or already have a social worker on staff who's got some capacity, or a child psychologist, right, who has some capacity to do healthy steps for that population, it's less of a heavy lift. We're not actively recruiting new sites because we want to figure out the sustainability piece first, and make sure that those sites have a sustainable financing pathway so they can continue to serve families. So that's where we are right now. We're always happy to have more in-depth conversation with practices who might be interested, and also are pursuing additional funding opportunities to start up new sites and increase the footprint. But we want to make sure sites are supported. So that's where we are right now. But if a practice is interested, please feel free to send them my way and we can talk about it.
Okay, and then the last question, and thank you everyone for staying on a little bit longer, is does your program build upon the CDC's Learn the Signs, Act Early initiative?
So I'm a little bit familiar with that initiative. It's really this focus on early childhood that I think both have, right? We're an evidence-based model that kind of continues to build the knowledge base around what's good for early relational health and young children, what's needed in those early years. So we're well connected at the national level with, we have a federal policy director who's well connected to everything happening at the national level and other organizations who are working on similar issues. I guess, yes, right, yes, and more. We're just trying to, the model continues to evolve to stay up to date with the most current research, and we really work hard to push that out to our sites. And that's part of the role the national office plays into making sure that the sites have the information, skills, experience, expertise to serve this population well.
Well, I just, again, want to thank you, Pam and Christina, for this fabulous presentation. And I'm so excited again that there are so many different questions and that there's some excitement about this model. I just want to remind everyone that this is an election year in New Jersey and all of our candidates are up for election. And it would be wonderful if everybody could share with them their interest in this program and why it's important for our children's health and development. We have an election guide that'll help you talk about the importance of a programs, just the same in a variety of different areas, but also the Healthy Steps program model. So I guess it just was put into the chat if you want to download the election guide. We'll also be sending that out after the presentation along with the rest of the information to really help you to talk to your candidates about why this program model is important. And again, if you ever need any kind of assistance in doing this, please reach out to us. That's what we're here for. Again, we're excited about this model. We're really excited to hear how it's unfolding in the pilot sites, and we really want to see it in as many pediatric practices as possible in New Jersey. So anyone who wants to be involved in this effort, please reach out to us. Does anyone have any final words to say?
Just thank you. Thank you for everyone joining. Thank you to Christina for sharing your stories.
Oh, thank you.
Hannah, did we cover everything? Anything? Did we miss anything? Okay, well then have a great day, everybody. And we're looking forward to continuing discussions about this program. Thank you.
Thank you, Diane. Thank you, ACNJ. We appreciate it. Bye-bye.
Thank you. Bye.